Hi everyone, my name is Tiffany and I am a research associate with Kaiser Permanente, Southern California. On behalf of my team, I present our study on risk factors of pancreatic cancer among patients within 3 years of presenting with acute pancreatitis. As a background, recent studies show that acute pancreatitis, or AP, may be an early indicator of pancreatic cancer. Previous studies have found that about 1% of patients with AP develop pancreatic cancer. Patients with AP have a 5.8 to 19.3-fold increased risk of pancreatic cancer within 2 years compared to patients without AP. Examining the factors involved in the association between AP and pancreatic cancer can inform future clinical care decisions regarding appropriate testing and surveillance and expedite the diagnosis of pancreatic cancer. So in this study, we sought to identify factors associated with an increased risk of underlying pancreatic cancer among patients with acute pancreatitis. We conducted a retrospective cohort study and included patients who were hospitalized with AP and were at least 18 years of age at the time of hospitalization. We excluded patients with pancreatic cancer prior to the acute pancreatitis. We evaluated patient pancreatitis-related and clinical characteristics and assessed the outcome of pancreatic cancer within 3 years of AP presentation. As the aim of our study is to examine the association and not the causal relationship between cancer and AP, we did not include a lag period after the patient's presentation with AP, and we restricted the follow-up to 3 years to closely investigate this association. For the analysis, we employed a multivariable cost proportional hazards model to assess the risk of pancreatic cancer within 3 years of AP presentation. We identified 9,490 patients with acute pancreatitis. On average, patients were 56 years of age at the time of AP, and 55% were female. 42% of patients were Hispanic, 40% white, 10% Black, and 8% were of Asian or Pacific Islander descent. We also examined etiology and found that 64% were biliary, 12% alcoholic, and 5% were hypertriglyceride related. Almost 20% of patients have other or unknown etiology. Among the cohort of patients with acute pancreatitis, 95 were found to have pancreatic cancer. Like the studies referenced in the background section, this number represents 1% of AP cases. The table on the right illustrates the results from our multivariable hazards model. Factors significantly associated with pancreatic cancer included older age, males, patients of Asian Pacific Islander descent, underweight BMI, presence of duct dilatation on an image, and other or unknown etiology. Smoking status, chronic pancreatitis, and presence of atrophy on imaging were not significant factors. On the next slide, we examine patients with other unknown etiology a little more closely in a heat map. We plotted the predicted risk of pancreatic cancer by age and etiology, stratified by gender, with females on the left and males on the right. The y-axis displays the 4 etiologies: alcoholic, biliary, hypertriglyceride, and other or unknown etiology. The x-axis displays the age from 18 years and older. Blocks of red and warm colors represent intersections of a higher risk. Looking at the last row for other or unknown etiology, the predicted risk for pancreatic cancer among both females and males is higher at older ages. To summarize our findings, we identified several significant risk factors for pancreatic cancer among patients with AP, of which the greatest risk factors are presence of duct dilatation on an image of the pancreas, underweight BMI, and older age. Like previous studies, other unknown etiology was found to be associated with an increased risk of pancreatic cancer. Patients with AP and these risk factors may suggest an underlying case of pancreatic cancer and may be considered for further evaluation. Thank you everyone for listening to my presentation today.